All right, Jason, thank you for that look. Today, the director of the CDC added to the recommendations of the CDC advisory panel to offer booster shots just to those 65 and older and those who are at high risk of COVID to now also include healthcare workers, teachers, and other frontline workers whose jobs put them at higher risk of getting it. Dr. Abby Olulade from Sharp Reese-Steely joins us now live to talk more about it. Doctor, thanks for joining us. Since we talked yesterday, that advisory panel did come back and recommend the boosters. Then the expansion came out. Talk to us about what getting a booster could do for you if you do in fact get one.
Well, certainly what we're seeing from the data from their meeting is that vaccine efficacy just go down over time. And so it just really just echoes what they said in their meeting the day before, that vaccine efficacy goes down over time. And because you may start to see more breakthrough infections and you may start to see more hospitalizations, then it is important to boost people that are at higher risk as a proactive measure. So it certainly could help to be an additional armor of protection, but it's important to remember that even if you are not eligible for a booster, you're still protected based on all the data. So that is a good thing. And I hope that this doesn't undermine the confidence of the vaccines, because I get that it may be confusing to a lot of people based on the way the process was rolled out.
As people look at the booster and the potential for getting it, is there any harm in getting a third shot?
Not from what we've seen. So part of what they always debate in these situations is the safety. They have to look at the safety and make sure that they have enough safety data to recommend this. And from what they're saying, there was no harm in terms of all the evidence that we have at the moment that given a third vaccine dose, that there's no harm from giving that third vaccine dose. So it does seem that it would be safe in those people that are eligible.
Okay, so that in mind, why do you think the director of the CDC expanded the coverage recommendation today? And what do you make of her overriding the panel stance?
Well, I think that, again, this is called novel for a reason. This is a new situation. It's a novel virus, and this is how science works. And essentially what happened was that the advisory panel was weighing the pros and cons of giving it to people based on their occupational exposure. And there was just not enough evidence from what they were saying that people get hospitalized or get severe illness because of occupational exposure. And certainly that could be because there are mandates in a lot of places for vaccines and there is mask wearing, but there's a lot of outrage, and, the CDC director essentially said that, she wants to do what will give the highest impact and the highest benefit. And when you actually look at the wording that they put out, they're saying, that they are recommending it, certainly, but in these groups that they added, people with possible occupational exposure, they may get it. So they're giving the option to get it based on individual preferences and, certainly discussions with medical providers. But it looks like it is safe. And so I do think it is a good thing that this has been expanded. But again, let's not forget that what seems to be getting lost here is that the overwhelming majority of people that are hospitalized are people that are not fully vaccinated or haven't gotten their first dose at all. And that's what we're seeing. And that is the much bigger problem on our hands.
So what's your message to people who are either on the fence, they're just not sure, they think this hasn't been out long enough, they have a lot of questions still, even though we're quite a ways down the road on this. What's your message to people who just aren't sure just yet?
Well, get a vaccine because it is safe. The Delta variant, is very contagious. It's possibly the most contagious variant, that virus that most people will come into contact with. So we are seeing that, your risk of getting it and, your risk of getting it is extremely high. But I think it is ironic that, people banded around this misinformation that the process was rushed. And, now we're on the other side of that, where people are saying, well, rush the process. We want all these answers and we want clear answers immediately. So I do think that, people should have trust in the fact that this was a transparent process and they are going to take their time to weigh science, data, and evidence. And so I hope that people do get that message.
Okay, let's talk a little bit about the timing. We kind of brushed upon it a little bit, but when does the original 2-dose regimen start to become less effective? And once we get this third shot, this booster, will that ultimately become less effective? Will we have to keep getting boosters perpetually?
Well, again, there are many people that have tried to look into a crystal ball and, when it comes to this virus, and unfortunately have gotten in trouble for that. We don't know. But you do raise a very, very important point in that what the data shows is that you saw a very clear correlation with the rise of the Delta variant and when the primary series became less effective. So clearly there is a very powerful effect from this variant. And again, highlighting the fact that the more we continue to let COVID spread and mutate, the more we prolong this pandemic. But essentially, part of the reason is that all vaccines do lose their efficacy over time. It does happen at higher rates in people that are older, for example, because of the way the immune system ages. And so they're essentially trying to risk stratify all of this. But, I do think that we have to remember that just because, this is an invisible virus doesn't mean that it hasn't gone away. We're still in a pandemic, and we all really need to remember that. If you know someone who hasn't gotten vaccinated, I would encourage them to do so.
Okay, yeah, so the sooner we can all kind of get our vaccinations and put this thing to rest, we'll stop some of those other strains like Delta and Mu from spreading. Last question, doctors. A lot of people had side effects, certainly from the second of the shots. Are there side effects, comparable side effects with the booster that we know of?
Yes, so we saw it from Pfizer again, and also from the meetings that the side effects are comparable, again, from data in Israel even. There was one side effect, lymphadenopathy, which seemed to be happening at a higher rate, but again, it got better and it improved, and you could debate the science of that. It could be because of more what we call reactogenicity, but essentially it is safe. The side effects were comparable, and so that's really what we saw.
All right, Dr. Abby Al-Olade from Sharp Reese Steely, thank you so much again for your time and insight, helping us understand the boosters as we move forward.
Thanks for having me.
You bet. All right, let's take a look at the numbers today. Man, they're back over 1,000 again. More than 1,000 cases of COVID and 7 more deaths reported today in San Diego County. The case rate for those who are not fully vaccinated, as Dr. Ololade was talking about, 4 times higher than those who are fully vaccinated. The hospitalization rate, the most notable number here, 34 times higher in unvaccinated San Diegans. A little more than 78% of county residents who are 12 and older are now fully vaccinated.